So guys, this is Briony.
And then he's got a fantastic rounding reflex too. Can you see here how his whole posture's changed? When we look here, we've got the swinging of the neck.
Hi guys, this is True Horses and I am Valeria, and today we are having someone over. It's an equine therapist, physiotherapist, Briony. She is very expert in what she does, and she's going to treat one of our horses. Actually, she's going to treat all of our horses, but we are only going to show you one of them, Gustav. She's going to explain about different techniques that she uses in her work and give us some tips on how to keep our horses more symmetric, more balanced, and more developed. So guys, this is Briony, and she's our equine therapist, physiotherapist, and she's going to show us today a couple of techniques that she's using for horses to release their muscles, right?
Yep. So all horses, when they're ridden and they're athletes, particularly ones like this, which are moving in a particular way, that are being asked to do these big movements, and also horses who have his bloodlines, they're bred to be a lot more expressive in their movements, and that can cause muscular tension. And obviously when you're competing at this level and when you're working at this level, it's really ironing out those creases and ensuring that your horse can move freely and is able to do what you want it to.
Okay, and so first Briony is going to assess him just in walk and trot in the arena, and then we're going to go back here and she's going to use her laser machine.
Yep, so I'm going to use a diverse range of therapies with her modalities. We've got laser, we've got ultrasound if we need it, we have H-Vawe, we use cupping on horses too, and lots of different massage and mobilisation techniques. I'm looking at the sequence of his footfalls, and that's correct. He's got a nice even gait. Watching him on the turn. That's it, so keep walking. So there's greater symmetry now in his hindquarters. There is a difference. He's definitely muscled up in his hindquarters. You can still see that the right bicep femoris, the quadriceps and the hamstrings are a little bit weaker. If you turn around and come back straight towards me now, you can try and keep him as straight as possible. I'm just seeing whether there's any deviation in front or behind. The right hind does seem to have an adduction on the flight phase, which means as it's coming in, it's just coming in a little bit here. Turn away and just trot off, just trying to keep him
straight.
Yep. So there I'm looking at pelvic symmetry, which is really quite good. Excellent, well done. Up to the trot. So his weight does tend to go there through, so that's nice and straight. Again, the right hind is coming in a little bit. Overall, it's very symmetrical. There's just a very slight deviation with the right hind. As it comes through, it just goes like that and in. But that's coming from a weakness in the thigh. So his quadriceps, so look at that, his quadriceps from his hip down to his stifle on the right side are a little bit weaker.
Okay.
And in the adductor muscles too. So you've got this here. So I suspect we're going to find some tension in his inner thigh.
So this might, what is that causes him not to want to stretch because he has pain. It's
because he's weak.
Hard for
there.
him,
So if he's weak and stiff there, he won't really be able to stretch down to the same extent that he would the other side.
Okay.
So could you just back him up? That's it. So I like to see them back up just because it shows whether they've got a correct sequence of legs. So that's right. So they move in a diagonal pair. That's it. He's a little bit shorter there in that left shoulder. Good boy. And a big pat. And then a tight circle round to the left-hand side. Want to see his back legs crossing over. Good, so there's no pain, tension or stiffness there.
Okay.
And the same in the other way, and we're just looking for a discrepancy between the two. And that's good too. In fact, I'd say he finds that way a little bit easier. There's much more of a cross that way.
In the front legs?
In both legs. So he just finds going that right turn easier, although his head's a little bit higher. We'll go back in now and we'll have a feel of his back and see where the tension is. So again, we're just looking for symmetry here because you've got more muscle mass here.
Yeah.
And then it drops away just here. And if we move the tail, can you see the real difference there? Whereas here you've got the quadricep that's coming out, and there it's a little bit weaker.
Yeah, and this even feels stronger.
Yeah, absolutely. So that's what we're looking to correct with the aqua treadmill and also with the treatment and schooling.
But it's kind of like with people, one side is stronger than the other, and you always have to make sure that you...
I think it's 95% of horses are all right-handed. So.
Really?
Yeah. So now feel the tension between the inner thighs. This one actually feels like nice, big, strong muscle.
Yeah.
And then feel this side.
You know, I have the same with my legs. My left one feels like this.
Yeah.
Well, my right one feels
our horses mirror us. So this is the lumbar fascia here. So if you think this is your thoracic, that's your lumbar, and then that's your sacral spine. So if we're just working here, you've got some tension. And can you see, if you just watch this part of his muscle here, you see that drops away? That's it. And it's very tight, so just feel this here.
Wow.
Yeah. You use lots of different techniques. See, he's a little bit sensitive this side. He keeps stepping away. Good boy, look at his face.
Enjoying.
He's enjoying it.
Look at it. Good boy, Gustav.
The assessment's shown us that he's weaker here, he's carrying more tension there, the left side's developing really well. So let's just have a look at the front end. So often the front end has to compensate for what the back end does. And we'll feel into the brachiocephalic muscle, into the pectorals.
As in compensate, you mean if the back...
The back can't push, the front will pull. So this is the tension there in this right pectoral muscle there. Do you see that spasm? Yeah.
It's releasing, right?
Yeah. So this is the tension and spasm there, and you can see it's affecting the elbow too. And all the way up into the neck and the jaw.
Wow.
See, into the splenius muscle. There you go. So we'll work on that with some laser. Sometimes if they really pull away, you know that they're very tight up here. You've got a big ganglion of nerves just here. He is a bit tight up there. So you can do little assessments. You can do lateral glides. Very tight in there. So you should hear the arcades of the molar teeth transversing, going crunch, crush, crush, crush as you turn. But there's nothing on that right-hand side. It's very, very tight. So this is a way of releasing the TMJ. That's it. So you think the TMJ joint up here, that's the temporomandibular joint. That's where the skull is joined to the mandible, to the jaw. You've got the hyoid apparatus that goes into the back of the tongue. That's all up in there too. The hyoid apparatus has got 3 muscular attachments down here. So any tension you've got here will always be up here too. We're just going to have a look at the other side. That feels good down there. Just follow the line of the brachiocephalic. And as you can see, we don't have that same spasmodic response. The muscle all feels quite nice and healthy in there. It all feels quite soft.
Yeah.
But again, it's just a little bit better developed in here. You can actually go all the way up the muscle.
So would you say that he's left-handed then?
I'd say he's... It's really, the majority of horses are right-handed, and then the majority of them do have that weakness in the right hind.
Because they overuse their right front, Or
yeah. Well, if you think about what we do as are you right-handed?
Yeah.
So think of what's used, you stabilise through your left hand.
Right.
So for example, if you pick up a water bucket with your left hand, and your right hand does everything. So their left sides tend to be a lot stronger.
Yeah, hello.
And their right sides tend to be the one that's got all the movement.
Okay.
There you go. Do you see the difference this side?
Yeah. Oh wow. Yeah, it's moving close.
So this side moves. The right side's very, very stuck in itself. And then here we've got fantastic thoracic lift hip. you know, he's got the mobility, he needs to be able to lift his back,
Yeah.
lift his shoulders,
And
lift
that's
the
cool.
thorax.
That's, yeah, on the left he's doing
Absolutely.
Oh wow, that's cool.
Yeah, so that's a really good exercise. And then he's got a fantastic rounding reflex too. So it really is a matter if we need to correct this weakness here.
Having done the full diagnosis, you kind of can say that the right side is much stiffer and weaker than the left one.
Yeah.
So you're going to focus on working.
Well, everything we do with the horse, you've got to create that symmetry. So there will be mild tension in his left side that we'll work through, because where he's not pushing so much with his right hind, he'll be pushing more with his left hind. So we will have to release a little bit of stiffness and tension in the inner thigh and the right. And actually, as you release this knot in him to here, it will release that, because you can see here it's going up here, it's all the way, and actually it's starting to go into his shoulder here. There we go. So that just gives you an indication of how just one little area really affects
the whole body.
The whole body.
Crazy. No, same with people.
Yeah.
Crazy how it responses.
Yeah. So you're looking at the tightness in the right hand side of him. So it just makes it easy. I wouldn't say he's in pain. Movement would have been difficult because he would have been tighter. Good boy. Good boy. Okay, so we're just palpating the stifle area. Horses are very quick to tell you.
Yeah.
Standing in a very vulnerable place.
But he's being good, no? He's really...
Exactly. There's no pain, there's no heat, and there's no swelling, and there's no reaction.
Meaning there's nothing broken or torn, it's just the muscle tension.
The other test that you can do for the sacroiliac joint, deeper in the pelvis, you lift the leg, you just support it there, and you can push the weight onto the opposite leg. So that tells me the sacroiliac on his left-hand side is happy.
So what do you think you'll be using today? Which techniques?
I think I will be using a category 3B laser to release the tension.
The infrared?
The laser and infrared. They're two different heads that I've got, so I'll be using them down his right side. We'll be doing more laser down his hamstrings. We'll be doing some myofascial techniques, some pelvis mobilisations, some spinal mobilisations, and then we'll release the tension in the back with the H-Vawe machine.
Okay.
So the H-Vawe
sounds like a lot.
Yeah. And then we'll finish off with some stretches, and I think that coupled with the work that you're doing on the water treadmill is going to be exactly what he needs, because he's a future star, isn't he? You can see it in him. He's absolutely beautiful. So we've got to treat him like that tip-top athlete. Yeah, absolutely. Yeah. But then that's why you use physios. The problems don't then manifest themselves in lameness.
Are you okay, Richard?
Oh.
So this is the infrared laser you were talking about, right?
Yes, so this is a cluster head, so it's got 5 different diodes in there. It is cold laser, and it is actually of the frequency where it can damage your eyes if you look at it. So it's one of the most high-powered lasers that you can use.
Wow.
You can get category 4 as well. But these are really, really good at just relaxing that muscle and promoting blood flow. When muscles get tight, blood flow through them is restricted, so the muscle becomes tight and dry and more prone to injury. So when you're using modalities like this, it really acts as a way of helping that muscle to increase the blood flow there, to increase cell metabolism and muscle metabolism. And from the horse's point of view, it just makes them feel jolly good. So I'm going to work all the way through this left shoulder and right shoulder and right side of his neck with him, and then I'm going to work through his right thigh with him as well, and then we're going to put the H-Vawe on him. And just all the time I'm just looking for little signs from him that he's enjoying it too, or that he's finding the sensation unpleasant. So I'm constantly assessing as I work through what I've done. And now, just before I H-Vawe, I think, okay, so where are we in terms of progress? What have we managed to do? And actually just standing back and having a look at him, now that we've relieved this tension, you can see that actually he's just dropping away a little bit here too. So we're looking at some more asymmetry through his back. If we go around to the other side, there's a little bit more muscle through this shoulder too, and that's extending. Can you feel there? And then you feel both sides.
And you can even see that it bulges up a bit.
Yeah, absolutely. And you can feel down both sides too. He's got more muscle just here. Do you feel there under the saddle? So we're looking to promote symmetry, and one of the reasons we use the H-Vawe, yes, it relieves tension and it has a slight analgesic effect, but it also promotes a better movement, it promotes symmetry, it increases muscle metabolism, so it really kick-starts the brain into thinking about using those muscles that he's not been keen on using before. You know, he is weak in that right hind leg, and what that's doing is he's got a certain movement pattern committed to his head in the movement centre where he dominates everything with his left hand side. So once I've done this and I've created that better symmetry and relaxed the muscles both sides of him, then it comes down to the rider then and the trainer really putting into the work and just asking him to use that right hind leg, and just to ensure that he is really using that right hind leg. Remember here you've got lots of muscle groups. You've got the longimus, the trapezius, the latissimus muscle. There's all sorts of muscles, they're all connected. And you're not just working on the muscles here with this machine, you're also working on the fascia. So fascia is a really important connective tissue that we need to look after. And you're working, so muscle fascia, fascia is an organ that runs throughout the body. And it carries, you just need one bit of tension in the fascia, in the back hind leg, and it can actually affect the movement of the horse throughout its entire body.
Wow. Is it on top of the muscles, or?
It's throughout the muscle, throughout the organs, it's in the skin. It's a huge connective tissue.
Okay.
So the H-Vawe is something I like to use as the icing on the cake. It's not my full treatment, but it works quite well. So I'm going to turn it all the way down because I don't want to give him any nasty shocks. Yeah, they do travel a bit.
So it is electroshocks?
Yeah, it is. I can pop it on you if you want.
I know exactly what it means.
So H-Vawe is a cross between electrostimulation, so that's your EMS machines, and they're the ones that help build muscle.
Do you work with them?
Yeah, I've got them too. And it's also got a TENS element to it too. So TENS is something that works on the nerves of underneath the electrode. So I'm just letting him settle in. You can see immediately what he's done is he's taken the weight off his right hind leg, and he's decided to put all of his weight through his left hind leg. So we're just going to correct him in a moment. Would you be able to push him back slightly so that he stands evenly on both hind legs? There we go. There, good boy. Exactly. And that's what we're looking for. So what you'll notice, if we look down into his stifles and his pelvis on this side, can you see they're moving?
Yeah, a lot.
Yeah, so that's because you've got a nice healthy sacroiliac, a nice healthy pelvis in there, which is actually moving like this. But you'll notice that the movement travels throughout his entire body. I'm not going to change the strength or anything that we're doing here. And you'll notice within the next few minutes, he'll just let go. So he's just trying to put himself in the most comfortable position. And also these electrodes, they're placed in a way that is telling him to go. You know, we're activating the muscle in the pelvis, and everything is telling his brain, move. Can you see how we've changed the profile of his back here too? So his whole back is up. Can you see the ribs are up? The core is up.
Is he a little bit kind of making himself bigger in order to resist?
But he has no choice because the machine has pulled his pelvis under and he's pulled his ribs up. So these muscles being activated. So what this really helps do is to lift the withers.
Well, the sort of here?
Yeah, So we're going to lift now the thorax up. So what you want when you're riding, we're just going to lift that up.
Kind of the uphill tendency, right?
Yeah, absolutely. That appearance where you want them to come up.
Yeah.
So interestingly, his reflexes are far stronger on the right side on that part of his body. Do you see that? Can you see here how his whole posture's changed? When we look here, we got the swinging of the neck. There we go. So now can you see the whole shoulders releasing? So all that tension where he's been on that shoulder.
You kind of didn't do anything. It's just over time, over a couple of minutes, it gets the whole body to release, right?
Absolutely, yeah. And you can see there, do you see it's going up his neck now?
Yeah.
Good boy. Again, he's on his left leg. There we go. It's just going to take this. So what we want is the tension out of the deltoids, out of the triceps. Because as long as this muscle is tense and dominant, he will keep on pulling himself along with it. And that, there we go, good. And you can see, can you see it's going all the way up his neck and his shoulders? Yeah, so when I pull his tail, just watch his whole body. So if you stand up against the wall, I'm going to start with gentle tail pulls. Good boy. Oh, he's doing what he thinks is right. And you can actually put the whole spine into traction.
Oh, look at this, it's completely rounding.
You can put the whole spine into traction, and it also releases the base of the neck.
What do you mean to put it into traction?
So in traction means to put it in tension, so to pull it, to stretch it back. So can you see the chest moving in and out? Yeah. There you go. So the other thing is you can gently just rock him here at the withers too. And you're just training that right foreleg to take a little bit more weight. Ideally, he should be square in front, but he doesn't. That's it, good boy. So you pull back, relax, push away. There.
In order to stimulate the right side.
Absolutely, and also look at the front. Look what's happening.
Oh, really?
Yeah.
The shoulders, the chest.
Yeah, absolutely. So you're moving the thorax around in the shoulders. That's it there. Good.
So this is something you would do if your horse leans on one side and you need him to balance out the weight. You can do this just before training, before riding, and it will really help them to use that during
just
the
to
ride.
Activate those muscles and commit those muscles to part of their muscle memory. Absolutely.
You can see really his back got so much up comparing to the when we just started. His belly, his core lifted, and here you can really see that it's not hollow anymore.
Absolutely. So he's up. He's in the right place. He's lifted at the base of his neck.
Yes, you. So guys, as you've seen, we had the equine therapy session. It worked really well for Gustav. I'm expecting to see some improvement in riding him tomorrow. Not actually tomorrow, because you have to take one day off after that. It's quite an intense work for their muscles. If you ever seen this done for humans, it's not recommended to exercise for a day after that because it's a workout for the muscles. And I really liked how you could really see how Briony relaxed his back, especially his right side, which is a stiffer one. So yeah, let's see how he's gonna feel after tomorrow. No, actually probably on Monday, because tomorrow is gonna be a day off. Then we're gonna lunge him, and then we're gonna ride him, and I'll update you guys about that. Guys, thank you so much for watching this. I hope you enjoyed and benefited from this video. If you wanna see more of this kind of stuff, you know, therapy and different experts helping our horses, please leave comments below, like this video, make sure to subscribe, and I'll see you next time. Bye bye.